Hello, Dr. Ian Beckingham here again. I'd like to take this time to discuss with you what happens at the first appointment, at the consultation. This is very important. The consultation is going to be probably our most important appointment together. What I need for you is to get all of your previous tests together. Maybe it's blood tests, MRIs, thyroid panels, x-rays, CT scans. I don't know what they are, but you have to get them all together for the last 2 years. No piece of this puzzle is too trivial or too small. This is the puzzle of you, so I need all this information. When you come in, there's also paperwork involved, and I know no one likes filling out paperwork and sitting there, but it is very, very important. So in the interest of time and to save you time, I have all my forms available at drbeckingham.com. You can download them very easily. They're PDF files. Fill them on out and bring them in. Now, when you fill out this paperwork, it is so important not to leave those short little 2-word answers. I know it's tempting, but I really need all that information there. Really just take your time and think it through. I advise people to maybe write down a list of symptoms on a piece of paper beforehand so they don't forget anything. Maybe they have headaches once a week. Maybe their left foot goes numb sometimes. None of it's too trivial, and it's all very important to what's happening with you and your condition. When you come into the consultation, it's generally about an hour that we spent together. You're going to leave there feeling that that was the most thorough consultation you probably ever had, and that's a good thing. At the consultation, we'll go over the tests, and I'll probably give you recommendations for further testing. Again, with this no stone left unturned approach, we need to get all this testing. All these panels that you've had done. I have thyroid patients that come in and say, well, I have my thyroid testing, and guess what? It's just TSH. Well, to tell you the truth, there's about 6 or 7 other tests connected even with the thyroid alone that have to be done. So that's what we need to do. One test doesn't tell us anything when there's so many other things hiding behind the corner that could be causing your condition. So when you come to my appointment, you bring the tests, you fill out the paperwork, we sit down and talk at length about your case. What medications you're on, you need to write those all down on a list. How you feel on them, were the dosages changing, was the honeymoon of your medication over? I don't know what's going on yet until you tell me. So that's what we're going to work on together. After that appointment, we'll schedule your second appointment. That appointment usually happens after we send you out for this further testing and the results come in. And then I sit you down and we talk about it. At that appointment, I'll tell you whether or not I can accept you as a patient. I can't accept everybody, and I can't help everybody. I wish I could. But I'm going to be honest with you, and I'm going to help you find someone that can help you. So that is what happens at the first one appointment, and then the second follow-up appointment. At the second appointment, I'll give you recommendations for care. And I'll tell you what I think it will take to get you better, to get control of your life again, to help you become what you were maybe 10, 20 years ago. That's what we're looking for here. We're going to educate you, and we're going to reduce your symptoms, and you're going to get control of your life again. So I look forward to seeing you. You can contact me at drbeckingham.com. You can call one of my 2 offices. I have one in West Los Angeles. I have one in Glendale. You can call me at either of those locations, and I'll get right back to you. You can send me an email at my website. What I really advise you to do, though, is to come to one of my workshops. I do them every 2 weeks. I do them at my 2 office locations, and I also do them at the Beverly Hills Public Library. So there are 3 locations that we can do these talks at. I advise you to come and get educated about your problem. Bring a spouse. We can educate them as well. They're a part of your life. They're part of what's going on with your condition, and they need to know as well what it's going to take to get you to be better. Better again, what you were again, to get control again. So I advise you to really come to one of those workshops. You can call me, you can look at the website, and they're all labeled right there, the workshops and when they are. I look forward to seeing you, and I look forward to hearing from you.